morning and welcome to Radio Friends on Tuesday, February 24th. It's good to have you with us today. We've got two very diverse topics. We're going to talk about eyes as we get older and then the theater. But let's start first of all with Dr. Rick Fraunfelder. Did I pronounce that right, Rick?
Yes, sir.
All right, good to have you here,
Thank
Doctor. You're with MU Healthcare, and you're an eye doctor, right?
Yes, sir. I'm an eye surgeon.
An eye surgeon. Okay. We were talking about the different types of problems that our eyes develop as we grow older. What's the biggest change in our eyes take place?
I think if we live long enough, it would be cataracts. If we live long enough, all of us will get cataracts.
Okay. And explain, what are cataracts?
Cataracts are when the lens inside your eye turns kind of yellow, just as a result of aging. If you touch your eye, you would touch your cornea, but just behind the cornea and the iris, the color part of your eye, is this clear lens. It should be clear, but when we get older, it turns kind of yellowish.
Okay, and the lens is what focuses so that we can see up clear, close or far away?
Yeah, it's
and
like the lens of a camera.
And as we grow older, it's not quite as flexible, is it? And that's why we have to have corrective reading glasses or contact lenses to see.
Indeed, you've been studying.
Well, that's because my eye doctor the other day when I went to get my new contacts said, oh, it looks like your cataracts are getting ripe. It might be time to have them taken out.
Yes, so the fancy word for when your lens stops moving when you get older, so the fancy word is presbyopia.
Presbyopia.
It means that I'm having a hard time reading as I've gotten older, usually in your mid-40s.
Mm-hmm. Okay, so when you have presbyopia, and you have cataracts, and you take those cataracts out, are you going to be able to see normally again when you put the new artificial plastic lens in your eyeball?
Yes, it's probably the most common surgery in the United States, is taking the cataractus lens out and putting a clear biocompatible plastic lens inside your eye. And we can put in a variety of different types of lenses. We can put lenses in that'll correct your astigmatism that's in your glasses, or we can put lenses in that will allow you to read and see at distance at the same time, sort of like bifocal glasses do, but we can put that lens in your eye.
So what you're telling me is that when you have cataract surgery, you could come out of that surgery not having to wear glasses or contacts anymore?
Correct.
Okay. And it's all painless.
In our hands, it's painless.
Okay. If people want more information on this, how do they go about getting it?
Well, we work at the university, so we're the University of Missouri Mason Eye Institute, and on our website there are resources to find every type of eye surgeon you could want. There's cataract surgeons, retina surgeons, glaucoma surgeons, ocular plastic surgeons, LASIK surgeons, that sort of thing.
Okay, glaucoma. Explain what glaucoma is.
Glaucoma is a disease of the optic nerve that is characterized by high eye pressure. So if your eye pressure is a little bit higher than normal, and age is another risk factor for that.
Okay, so that's when you go to get your eyes examined and they do that little puff of air in your eyes, they're testing for glaucoma.
That's what people are doing, yes.
Okay, all right.
Yeah.
But as far as the cataracts, that's pretty common as we grow older.
It's going to happen to you, Mr. Pepper.
Okay. It's already happened. All right, Mr. Doctor, Mr. Rick. Good meeting you,
Thank
Rick.
you very much.
Okay. You got to see how young this guy looks. Go to KBIA.org and watch the podcast. He walked in, I said, you can't be a doctor. You look like you're about 19 years old.
Thank you.
And you told me you're in your late 40s, right?
Yeah, 47. Is that late? It's 47.
That's late.
47 is the age.
Yeah, okay. Well, congratulations on holding your age there,
Thank
Doctor.
you very much.
For more information, you can go to the University of Missouri Hospital website. Good to have you here.
Thank you.
Okay. I'll probably be seeing you at the cataract stuff. Now, we turn to Elizabeth Braaten Palmieri.
Hello.
GreenHouse Theater Project. Good to
Yes.
have you here.
Nice to be here.
And you brought along a special guest.
Yes, I have an actor, a visiting actor of ours, is here from the UK. Her name is Rhian McLEAN.
Good to meet you, Rhian.
You too.
You know, I'm so impressed that GreenHouse Theater you fly all of these people over from Europe for your project.
Yeah, all these people. We're such a European collective of actors.
Right.
Yeah, well, you know.
I came by dinghy.
You what?
I came by dinghy, by boat.
Okay.
She was actually here last year. She did Three Sisters
Yes, I
with us
remember
at
her.
PS
I
Gallery.
remember.
Yeah.
And you had so much fun, you came back again.
That's it. Yeah.
That's it.
Couldn't keep me away.
Well, we've got a hot new show, and so she was kind of chomping at the bit.
So what is the show?
We're doing Don Juan After the War. It's our own adaptation. The adaptation is actually written by my co-artistic director, Emily Adams, who is now relocated back to the UK. And it's a really exciting piece. It's a very physical piece of theater. It tells, the classic story of Don Juan, but it's set in post-World War I Berlin. And yeah, it's a sexy piece.
It is a sexy piece. It's kind of the themes of love and war and loss and how those work together and how we respond to them as kind of human nature responds to them.
This is an original. This is a world premiere, correct?
This is a world premiere, and GreenHouse does this. We just don't always make a big fuss about it, I guess,
Well,
which I guess
think
we
you
need to
should make
start
a big
doing
fuss.
sometimes. But yeah, it's a world premiere. It's an exciting piece of theater. We're collaborating with some new people this time around. We're performing in Silverbox Studios. It's a photography studio. It's at 107 Orr Street, and it's right upstairs from Wilson's, Wilson's Gym. So it's in the North Village Arts District.
And
where
if
we
you're
love to
not
perform.
familiar with Greenhouse Theater Project, they move around from building to building.
We
for
take
each
over, yeah.
Yeah, for each one of your productions. And
Yeah.
sometimes you're outside. Sometimes
we're outside.
you're on the rooftops.
Yeah,
aren't you?
exactly. I mean, that's what's exciting to us, and that poses the challenge, and I think that's what makes what we do interesting in this community. So yeah, so this piece is, it's going to be a lot of fun. It opens tomorrow, February 25th.
Oh, you're opening tomorrow.
Yeah.
And you had time to come and be with us today.
We're all ready and prepped. We need the audience now. That's all we're
Yeah,
waiting
we need
for.
the audience. So we run this whole week. We run Wednesday through Sunday, March 1st. Our shows are at 8 p.m. Tickets are totally selling out, so there's some left.
Totally selling
yes,
out.
we always sell all of our shows out. So you have to go online to pre-buy, and that is at greenhousetp.org, and that's what we suggest because they do sell out, and people show up at the door, and we always feel bad because we're in these small spaces. We can't always get as many people as we wish we could in. So yeah.
Okay. So when you go check it online, it'll tell you whether it's sold out or not.
Yes, it will.
Okay.
Yep.
So save yourself a trip if it is sold out. But have you ever had people come and you're sold out and they're just begging
Sometimes
you,
we get people in. Sometimes, yeah, we get people in. We have a wait list so people can check it out. Check out our Facebook, too. So
Yeah.
we have images, and we're going to have a trailer that's going to be posted.
All right.
And,
Thank
yeah.
you so much for coming by.
Thank
It's a
you.
pleasure
Thank
seeing
you.
you again.
Thank
Okay,
you.
tomorrow, Vera Massey, MU Extension. Our program directed by Travis McMillen, Reynolds Journalism Institute. Audio is Pat Akers from KBIA. Our floor director is Lowell Thomas. And our assistant producer and guest coordinator, Uncle James Mauser. If you'd like to watch us or listen to it again, kbia.org. We'll see you tomorrow. Bye-bye.